Hi, my name is Chelsey Erpelding, and I am graduating from the Extend program at Nebraska Methodist College. Today, I will be presenting on my educated citizens and my capstone project, which was human trafficking in Nebraska. This issue is important to me. I come from the nonprofit world where I worked previously before becoming a nurse, and I saw a lot of vulnerable people. I learned a lot about our community. At one point, I did work with child welfare, and we had a training about the signs to look for in children, what makes a child vulnerable for trafficking. It was very eye-opening. Um, so that is why I chose this topic. Social justice is very important to me, especially thinking about being a nurse and all of these vulnerable populations that we will encounter. Um, Human trafficking affects those who are most vulnerable. So anyone who has been in the foster care system or social or juvenile justice system, anyone who has an addiction or has a family member with an addiction, a history of sexual abuse, unstable housing. Um, there's a lot of different things that can impact a person's risk for being trafficked. And I think it's important that we're aware of those things. So just some things about human trafficking. Human trafficking involves the use of force, fraud, or coercion to obtain some type of labor, that being commercial labor or sex labor. In Nebraska, the reported victims of human trafficking, 48% were female, 30% were minors, 90% were involved in sex trafficking, and 10% were involved in labor trafficking. Additionally, another report found that 60 to 80% of human trafficking victims were formally involved with the child welfare system or in foster care. So, thinking back about my educated citizens and how I was an effective communicator, um, one of the experiences I had was working with a respiratory failure patient shortly after my mother had just died from COPD. This was literally a few days afterwards. Um, so, one thing I took away from that experience was really understanding how to communicate my needs, understanding what my triggers were in that moment, and understanding what boundaries that I needed to have. That also led to just a bigger understanding about communication surrounding death and dying and grieving. It was very eye opening for me to be on the other side of that and to really have to sit with what those feelings were and understand the patients that we have been encountering and how they must be feeling during those things. So the application for this really was for me to think about how to be a compassionate nurse, being empathetic and understanding, and just in general, the fear and anxiety that surrounds death, especially in our society. My second example of being an effective communicator was just an instance as a student where I saw another professional who was kind of speaking down to um, some other of my classmates. And I just felt as an older student and as someone who, you know, left the professional world and is going to be re-entering soon, it was really important for me to speak up on behalf of those students. It can be really scary to say something when you see something, but I really do feel like as a nurse, that's a huge part of our role is to be able to speak up when we see something that is unsafe and to not be afraid to um, talk to our coworkers or even our superiors when we notice something safe or unsafe, or if we notice something that is a violation of HIPAA or could do anyone any harm. So even though it is very scary sometimes to speak up, I do feel like that is incredibly important as a nurse. In terms of my role as a reflective individual, um, I wrote about an experience I had on the med surg floor in clinical. Um, we were working with patients who had a lot of requests and maybe not a lot of like high needs at the moment, but just a lot of um, wanting things like coffee and sugar and extra sugars and things like that. So my takeaway really was um, observing the nurses and how they manage their time and how they manage their priorities. And I think that was really important for me to see. And also, again, about the boundaries, being able to say no, being able to just not really feel bad about not being able to answer every call light or fulfill every person's need at that very moment, because as a nurse, we really will have to prioritize. And really thinking about this as it relates to human trafficking, I think it's important that we really understand kind of what the greatest needs are at the time if we are able to help someone who has been in a situation like this, really making sure that those Maslow's hierarchy of needs are being met. So that was my big takeaway from this as a reflective individual. My other experience as a reflective individual was working on both the PCU and the ICU floors, and just really observing different conversations surrounding end of life and end of life communication. Um, there were really a couple moments that I witnessed where um, I didn't feel like I saw a lot of honest conversations going on between providers and patients. And then I did see some really great, honest conversations going on between palliative care and patients. And I do think it's really important for everyone as nurses to really be able to speak on a person's wishes and honor those wishes and advocate for them. Um, so again, I think my application for this as a future nurse, no matter what role I'm in, will be to educate my patients about advanced um, directives as well as living wills, and also really educate my patients about their options. What does comfort care look like? What does hospice look like? Um, just really allowing them to sit with their options and ask questions and bring those conversations kind of into the forefront instead of avoiding them. One of my experiences as a change agent was at a food pantry. Um, so we worked at one of the food pantries here in town in one of our first terms, and I experienced a lot of different families, a lot of different individuals coming from different backgrounds and had very different needs. Some had very large families with multiple kids to feed, others were just one person, some had medical needs that they needed to adjust their diet for. So when we first went to the food pantry, it was told to us exactly what we were supposed to give each person and each family. Now, when families came through that didn't exactly meet the parameters, sometimes I would give a little extra here and there if it was a really large family. And I felt like that was really important. Also, there was a person who was diabetic, so he only could have a certain type of oatmeal. And um, my takeaway from that was just to really think about the systems that we have in place that are safety nets or here to help people. And I know that they are also limited, but we need to think about some flexibility in terms of what help we're providing for others and if it's really meeting their needs and how we can be a little bit more flexible when we're offering help. I think the application to nursing for this really is asking people about their needs and their goals and assessing them and advocating for them. And I think this is completely applicable to human trafficking victims, really understanding what their goals and priorities are for their lives and for their safety, of course. Next, I wanted to talk about another change agent moment. This was working on the population focus project. We worked with Nebraska AIDS Project, and we really focused on PrEP, which is prophylaxis for HIV. We learned a lot about the risk factors involved with that and found that in some studies, people were less likely to use condoms or um, maybe were less taking less safety measures when having sex. And I do think it's really important when we are working with different cultures and communities um, to understand um, more about their situation and their lifestyle before we assume that if someone is on PrEP that they are having risk behaviors in their sex lives. And so I really wanted to examine that in myself as I read the studies to wonder who is completing in these studies. Are these people in long-term relationships, or what other factors do we need to think about? And of course, we need to provide education for people that just because you take PrEP, it doesn't prevent any other STD. So that is of course important, but I also felt like it was important for me to examine my own judgments and assumptions, and some of the assumptions and judgments that felt like they were being presented in some of the research that we read. Um, and again, I think that application really can be applied to any patient, but especially with the human trafficking victims, really removing our own judgment and assumptions about people and what they've experienced or what their goals are. It's going to be incredibly important as a nurse to remain open-minded and willing to learn. And yes, we are experts in some ways and we do provide education, but it also should be met with compassion and kindness and understanding. So in conclusion, I felt like this year taught me a lot. I learned about myself a lot. It was an incredibly tough year, especially going through the loss of my mother during a really stressful time. Um, but reflecting on all of these experiences, I really do feel like nursing is about holism. We are providing medication and treatments to people, but even more so, we're asked to be advocates for them and to listen and to use our intuition to understand what's going on with them. And so, just reflecting on my own abilities, um, my own willingness to listen and be open and communicate effectively and be a change agent in my community. I know that it's not always tough, but I am hoping that I can really help and make an impact on the people who I work with. Thank you. References.